WentWest has a really important responsibility, and that is to spend money on what the people want and see for themselves is necessary. You have literally a mini world. You've got this amazing community of quite a significant number, in fact, one of the largest urban populations of First Nations people. Then you've got this big migrant community. So there are unique health challenges in Western Sydney. First Nations communities have a whole different story. They've got a history which has affected the way healthcare is provided and the way they respond to what's available. The other community, it has got a different story altogether, and so the way they receive healthcare, although there are things in common with First Nations people, quite often it's a separate thing, and we took the brave decision that we would separate them out for that reason. Friday night is where everybody meets each other for the first time, and Friday night is the opportunity to set the culture for the weekend. So that public good lens is really crucial.
To make a difference in Western Sydney.
Yay! We are all here as citizens, and we're all here to represent the community for the public good. Saturday is a very intense day because they're listening to a very carefully curated program of evidence. We ask the question, should we, the citizens of Western Sydney, continue to invest in healthcare in the same way as we have in the past? And that opened up the conversation to really interrogate, what do we spend now? What's the return on that investment? There's no PowerPoint. You know, it's not a lecture or a conference. It's really a different thing. It's a conversation, but based on good information. The Sunday, the experts have left the room, and there is a facilitated discussion about what they heard and what's speaking to them about what they heard. And they come to their decisions on Sunday evening. And what we walked away with was a very, very different kind of experience to the normal town hall experience or the survey experience. At the moment, 8 or 9 grand is spent per year per person on healthcare. But only 1% of that, $89, is spent on stopping people from getting sick. And there was not one person in those two groups that didn't want to focus on how do we not get sick. WentWest invests in Western Sydney. So this is, as we speak, we are talking to our colleagues about what we heard and starting to think creatively about how we can connect our investment agenda at WentWest with what people want. My colleagues are saying, bring it on. They're saying this is really exciting. We have to be listening and be prepared to throw out our assumptions, but we've got to provide the good quality evidence for them to come up to a way that is an equal level playing field.